Hello, my name is Dovile Olenkoviciene, and today I will represent human immunity. The immunity system is a complex system that is responsible for protecting us against foreign infections or foreign substances. There are three lines of defense. The first one is to keep invaders out. The second line of defense consists of non-specific ways to defend against the pathogens that have broken through the first line of defense. The third line of defense is mounted against specific pathogens that are causing a disease. The epithelial cells lining the urinary tract are the first line of defense against the pathogens. The urinary tract has a number of very effective barriers to infections. The bladder is protected by the urethra, the tube that drains urine down from the body. In males older than 6 months, the urethra is long enough that bacteria are not able to pass through to reach the bladder because of frequent movements of urine from the body and getting out from the body. This is the way that our body effectively washes the pathogens out. In females, the urethra is rather shortened than in adult males, and as a result, thus occasionally allows external bacteria to pass into the bladder. During pregnancy, the bladder is very little protected against the pathogens, and urinary tract infections can be become very common. This is because the hormone estrogen has a relaxing effect upon various tissues, including the urethral appendage, and this is how it allows easier access to the bladder. However, regular emptying the bladder has a flushing out effect, and it does prevent from many infections. An inflammatory response begins when pathogen stimulates an increase in blood flow to the infected area. Blood vessels in that area expand, and white blood cells leak from the vessels to invade the affected tissue. These white blood cells, called phagocytes, and destroy the bacteria. This is how the second line of defense looks like. As an example, we can look at the third line of defense, acquired immunity. Acquired immunity is not presented at birth, it's learned. As a person is exposed to the natural environment, the body immune system encounters antigens. Acquired immunity is essentially a learned response from the body's immune system, determining the best way to attack each antigen and begin to develop a memory to that antigen. Acquired immunity, it's also often called specific immunity because the immune system tailors to attack only to specific antigen that the body has encountered previously. Artificially accounted immunity can be described by two mechanisms: actively, which the body intentionally expands to the foreign antigen in a vaccine, and passively, by introducing performed antibodies into the body to generate a protective immune activity. When the immune system detects a foreign antigen, it stimulates the body to produce antibodies that remain in the body and attack the specific one to destroy it when it invades the body. And this how it acquires the immunity for the future attacks. Artificially acquired immunity rapidly shuts off infections antigens, usually before the disease symptoms can manifest, and you would probably likely not to know that you had an infection at all. The human immune system is very complex. And can have different terms of responses to antigens and pathogens. The immune system does not have the same level of sensitivity to all antigens. Hypersensitivity reactions are exaggerated in appropriate immunological response, occurring in response to the antigen or allergen. Type 1, 2, or 3 hypersensitivity reactions, known as intermediate hypersensitivity reactions, because they occur within 24 hours of exposure to the antigen or allergen. Autoimmunity is the response of the adaptive immunity system to self-antigens that occurs when mechanisms of self-tolerance fails. Autoimmunity is the one of the causes of the hypersensitivity in humans. Self-tolerance in the immune system's ability to recognize what is self and not to react against it, to attack it. If immunological self-tolerance is lost, the body develops an autoimmunity against its own tissues and cells. Antigens produced by Staphylococcus aureus, for example, are significantly different from the antigens produced by red blood cells. The unique nature is of antigens allow the immune system to distinguish between self and non-self. So therefore, there's only the non-self cells to be attacked. This is a bit more explanation behind the picture, how the body recognizes itself. However, transplantation is an act of transferring cells, tissues, or organs from one side to another one, typically from one person to another one. When a person receives an organ from someone else during the transplant surgery, the receiving person immunity system might recognize it that is foreign. This is of course because the person's immunity system detects that the antigens of the cells or the organs are different, and that's why it's recognized as being not self. Organs that are not matched closely enough to the recipient can trigger the blood transfusion, injection, or transplant rejection. Monoclonal antibodies can be used during and after the surgery to knock the specific T cells, which causes the rejection of the organs. If these medicines are not used, the body would almost always launch the immune system response and try to destroy the foreign tissue. Rheumatoid arthritis is an autoimmune and inflammatory disease, which means that your immune system attacks healthy body cells in your body by mistake, causing an inflammation, a painful swelling in affected parts of the body. Arthritis mainly attacks joints, usually many joints at once. Most common joints in the hands, wrists, or knees. If the tissue are damaged, can a long-lasting chronic pain and deformality. Another one, immune system disorder example can be taken lupus. People with lupus are more likely to experience infections and infections-related complications. This is because their immune system is weakened by both the disease and the medicals used to treat it. The most common infections of the people with lupus include those of the respiratory tract, skin, and urinary system. Let's see what is acquired immunity. So, naturally acquired immunity. This is a type of immunity that develops from being exposed from the pathogen that causes a specific disease. This way was explained previously. Artificially induced artificially induced active immunity involves when an individual being artificially or intentionally exposed to the foreign antigens in order to generate protective immune system response. Naturally passive immunity in the processes when antibody are transferred from the one person's to another, uh, such as post antenatal from mother to the child. And artificially induced passive immunity is a protection acquired by giving a person an injection or transfusion from the antibodies that are made by someone else. The vaccine will that vaccine will only contain a weakened or harmless version of pathogens, which means that the vaccinated person is no longer in danger to develop the specific disease. Some people, however, may suffer from the mild side effects after the vaccination. If the person, but however, if the person will be affected by the disease in the future, acquired blood cells are able to produce rapidly the pathogens and destroy it. So this is called as immunological memory. So it also can be called by primary and secondary response. This is when the pathogen is encountered for the first time, and it takes time for the antigens. So the primary response is when the antigen is encountered from the first time. It takes time for the antigen to be identified by B lymphocytes and for the appropriate antibody to be produced by the plasma cells, which allows time for the infection to take hold in case the associated symptoms. Memory cells are produced at this point, which will be able to recognize the same pathogen if it's encountered the second time. Secondary response is when the pathogen is encountered the second time and the memory cells recognizes that pathogen and produces high quantities of antibodies in a very quicker and for a very quicken time to fight the disease much quicker. And as an example of the vaccination benefits, I would like to show infection rates in the UK between 1940s and now. So the measles is a highly contagious, a serious disease caused by virus. Before introducing the measles vaccine in 1963, you can see that it was widespread and it was a high death number. After the inducing the vaccine to the measles, the rates were falling down almost 10 times, and now it's manageable. And this is how it comes. This is how it decreased 73% only because the vaccine was induced to the people. Uh, okay, to um, this also the example of measles could be a good example for the herd immunity. So just to understand the herd immunity, so we first need to remember that all contagious disease is one that is spread directly from person to person. There are a number of potential methods of transplantation, but the spread from person to person is the key. When a high percentage of the population is vaccinated, as it was done with the measles vaccination, it is more difficult to contagious disease to spread because there are very few people in the population that can become infected. Herd immunity can effectively stop the disease from contagious disease spread that is given into community. This is particularly crucial for protecting people who cannot be vaccinated, including the young people, children, or even people with some disease that cannot be affected for certain reasons, or the pregnant women. So this is a very is the alternative protective for the ones that cannot be taken. It cannot be partaken by the vaccinations. Also, we can speak about we can take into consideration the good example of just um, of the recent global pandemic, the COVID-19, which was as well after which was as well a very quick spread, and loads of deaths were common before the vaccination came into the place. Now, when we have the vaccination, it is much easier to protect us, protect our families, and the ones who cannot take the vaccination for certain reasons. So this is how we also created the herd immunity, and now the COVID-19 spread and the timings are spread, and the numbers are much lower. So thank you so much for listening this presentation. I hope you liked it and it was informative. This is just a reference for the um, books or other publicity that was used in the presentation. Thank you so much.